I would ask Dr. Saba Shuja, Manager ECD, UNICEF, to share conference findings, recommendations, and the way forward to ECD.
Thank you very much. Assalamu alaikum. Respected Sir Amir Ashraf Khwaja, Federal Secretary. Assalamu alaikum, sir. Professor Dr. Nasir Mahmood, Assalamu alaikum. And Mohammad Rafiq Tahir Saab, and Dr. Nusa Badr Saab from Federal Ministry. And ladies and gentlemen, thank you very much for being here till the closing session. We would like to share key recommendations and as well as key notions, what we are taking back with us. But before going to sharing the key notions, sir, I just would like to reflect back what we envisaged when we were designing this workshop. What was in our mind in terms of outcomes? So those are, we wanted to establish a common understanding of the complete and important phase of early childhood development, from conception to 8 years. Why it was important? So that everybody would be on same page that it's a multi-sectoral, and there are different sectors, different ministries, everybody has to play its role. So that was one of the outcome we were thinking, and hopefully we have achieved that. And of course, moving ahead, we are already developing, in fact, we have developed ECD policy framework, thanks to Ministry of Planning Development Special Initiative, taking lead, and all the partners are supporting. So now, through this workshop, we wanted to have a commitment and understanding that such kind of policy legislative environment is already there. We have policy instruments about to endorse how we are going to make our commitment for the implementation. Third, to look how interagency and partners can have really, common understanding around promotion of holistic ECD, multi-sectoral approach in Pakistan. We were aiming to create a partnership among government, academia, and as well as civil society organization, and the coordination between all the multi-layer, multi-sectoral actors, and as well as to look around how we can strengthen, if it is there, public-private sector partnership. So, sir, these were the outcomes of the conference. Now, moving ahead, what were the key notions out of these two days, marvelous presentation, engagement from student to experts? The key notion is ECD cannot wait. Now, it's time to act. What we need to do, we need to scale it up. How? In a coordinated manner. We need to reach communities. We definitely would be working on enabling environment, but this is a time, after so many years investing in ECD, that we need to reach communities. The distinguished point of these 2 days were ECD in emergencies. This was the key notion. We were discussing about how to make ECD integral part of ongoing emergency response, and God forbid, upcoming any emergency and humanitarian crisis. We all agreed, all the researchers, all the presenters, all the keynote speakers, that we need to adopt an integrated multi-sectoral approach, without which probably we won't be reaching our aim or the outcome. Systemic approach. ECD should not be seen as a parallel structure. It's a systemic approach, sir. It should be seen as a system shifting model. More in-country research is required, though so many research papers and studies were present, but still we feel that there are room and gaps where we need to have more researchers on nurturing care in this country. Indigenous knowledge capturing is required. There were comments from our August participant that we need to aware all at population level and all level, and we need to have comprehensive, holistic, integrated media engagement. Last but not least is the public-private partnership. How to engage private sector on this? Now, moving ahead, what are the key recommendations? We have ECD policy framework, index, and standard. Now it's a time for urgent endorsement and the dissemination of these policy instruments so that everybody can use it and plan accordingly with a common standard approach in this country. We were lucky to have our parliamentarians as well on day one, so there was a great debate around that, and key recommendation was that we need to take all parliamentarians on board and to build their capacity, orientation, and advocacy around early childhood development. So that is very strong recommendation came from day one. Moving ahead, the existing ECD governance structure, we need to have a sustained approach of capacity building, and we should invest into that and to continue working on enhancing the skill, understanding, and capacity for the governance structure who are responsible to take this agenda forward. There was this interesting discussion, sir, on the ECD legislation, the family-friendly policies, and those laws which are actually contributing and supporting ECD mandate. For example, BMS code. So the great commitment out of these 2 days were that BMS Code Act should be, endorsed or promulgated by the Parliament, and we are moving ahead for the submission of the revised legislation. Hopefully soon we'll be hearing some good news around it. Accreditation of ECD curriculum and developmental of the ECD workforce. That was a very strong point highlighted on the day one, that though there are universities who are working on ECD curriculum, now it's a time to have a real accreditation and proper ECD workforce. Inclusion of ECD module into the higher, sir, this is a very interesting point for you to consider, that whatever the higher education studies, curricula, courses we are developing in this country, how we can make ECD inclusive, how we can include early childhood development modules so that the upcoming generations or the students should have the clear concept of early childhood development. So today we have a fruitful discussion, in fact, very thought-provoking discussion around ECD financing, how to cost ECD intervention. So the recommendation is that we need to have in-house capacity building on early childhood development financing, how to cost. So that's one key recommendation to look as a way forward. And community-level ECD approach. We have facility-based approach, but probably this is the time to think about more on community-led ECD approach. What are the global, regional, and even in country models available? ECD in emergencies, there is a consensus that they should be part of disaster response and management plan and authorities. And sir, we would be reaching to NDMA, PDMA, and all those authorities who are taking care of disaster planning, mitigation, and response, so that ECD can be an integral part of all responses. Inclusion of marginalized children. We have had a discussion of those children who are living with disabilities, how to focus, how to include them, and our focus should be on families. We have governance mechanism, but then there are so many stakeholders, multi-layer, multi-level, and they have motivation, they have interest, how to engage. So the key recommendation is to devise a mechanism for engaging all the relevant stakeholders beyond governance structure, so that they can, as a citizen of Pakistan, contribute. So that's very strong and enlightened recommendation we've got. And the stocktake of ECD work, because we have heard so many good examples in country from partners and others and researchers in academia, that things are going on. Let's stocktake and let's have a comprehensive picture of early childhood development in Pakistan. So thank you very much, sir, for patiently listening to me.